Go ahead, Bobby.
Got it. Yep, I'm just giving it a second.
Mhm.
Hello, everyone, and thank you for joining us. We're here today with Dr. Mark Rickford. Mark Rickford. I always get that messed up. Sorry, Dr. Rickford.
No problem.
Who is the medical director of Bariatric Services, General and Minimally Invasive Surgery for University of Maryland Capital Region Health. And he's here today to talk to us about some surgical solutions for permanent weight loss. So, Dr. Rickford, thank you for joining us.
Thank you for having
I'm
me.
going to start with you're very welcome. We appreciate it. I'm going to start with a question. What does it mean to be obese? And for those of us who have weight challenges, why do diet and exercise not work for weight loss in obese people?
Obesity is a medical condition in which there's excess body fat, which may have a negative effect on your health. Some of the medical conditions associated with obesity include hypertension, diabetes, obstructive sleep apnea. Some cancers are also associated with it. Now, when you say diet and exercise don't help with obesity, that's true once a person reaches a certain level of obesity. Obesity is defined by a term called body mass index, which is a measure of height over weight, meters squared. So you're considered obese when your body mass index is greater than 30. Normal body weight BMI is below 25. Um, we consider patients candidates for surgery when their body mass index is greater than 35 and they have medical problems associated with obesity, such as hypertension and diabetes, as well as a person whose body mass index is greater than 40 BMI. In general terms, a BMI of 40 you would be considered approximately 80 to 100 pounds over your ideal body weight. Now, in terms of diet and exercise are critical for weight loss, of course. But once a person reaches a certain body mass index, studies have shown that it is not an effective treatment. The reason being is multiple. Number one, when you are going on a diet and exercise is you should think of more for maintenance of your body weight. Many people will go on treadmills and run for 30 and 40 minutes or elliptical bike. If they watch the little figures that they put in after they do their exercise, they can exercise vigorously for as much as a half hour and burn maybe 200 to 300 calories. However, if you drink a 20-ounce bottle of soda, those calories will be about 300 calories. So therefore, you can see the imbalance that can occur depending on your diet. So one of the things I really stress with patients is really the diet is most important, but exercise helps to improve your cardiovascular health. Uh, Now, in terms of weight loss for when patients go on diets and things, one of the things that can happen is as you're dieting and exercising to reduce weight, your body doesn't recognize all the time that you're trying to accomplish this. So sometimes your hormone levels may adjust to promote weight retention, and also you may have an increase in your appetite and a slowing of your metabolism. That slowing of metabolism actually means that you're actually conserving the same calories which you're trying to burn. Good thing about, of course, exercise, it does stimulate your metabolism.
So, in general terms, if you've got someone who is, I don't know, 5'5" tall, what weight would they normally be to be considered obese? 250, 200 pounds? I mean, where do you see the most benefit to your patients? At what weight range?
So generally, patients who are approximately 80 to 100 pounds over their ideal body weight would be considered candidates for surgical intervention. So if you think of a person who's 5'5", normal body weight for that person for a female might be 135 pounds. So if you're over 50 pounds more than that, you would be considered obese. If you consider 80 pounds over that, you can be considered morbidly obese. So those are the types of figures to keep in mind. Now, when we talk about morbid obesity, the reason why we have the different options for weight loss is because studies have shown over the years that just most patients with diet and exercise are not successful in maintaining the weight loss. And remember, the reason why we're trying to have these patients lose weight is because we're trying to give them a healthier and happier life. We know that with the excess weight, it increases your risk for developing things like high blood pressure, type 2 diabetes, things like obstructive sleep apnea, which is a condition whereby when you go to sleep, you go through spells where you stop breathing, and a multitude of other, even certain cancers have an increased risk with obesity.
Okay, so what does weight loss surgery do that actually ameliorates that or makes it easier to keep the weight off other than just making your stomach smaller?
Right. So depending on the surgery that you do, we do two different surgeries at our program. The main two surgeries that we do are the Roux-en-Y gastric bypass and the vertical sleeve gastrectomy. All these surgeries are done by a technique which we call laparoscopy, where we make multiple small incisions on your abdomen, inflate your abdomen with the gas, then looking on the TV monitor to do the procedure. The advantage of this is a faster recovery time. Cases are only in the hospital overnight, go home the next day. They're actually up and walking 6 hours after surgery. So it's a much faster recovery time and able to get back to work sooner. The reason why this surgery is more effective is because it's actually a tool that's going to help the patient. So, for example, with the vertical sleeve gastrectomy, we are decreasing the capacity of the stomach significantly. The stomach, in rough terms, may hold about 1,000 milliliters of fluid. After the surgery, it'll hold approximately 60 to 100 milliliters of fluid. When you are um, eating food, the food comes into your stomach and causes your stomach to stretch. When your stomach stretches, it sends an impulse to your brain that you're full. Of course, if the capacity goes from holding about 1,000 to holding 60 to 100, of course you would get full much more quickly. Um, and then, in addition, there's also a hormonal component with the vertical sleeve gastrectomy, whereby when we remove that portion of your stomach that you can see on the screen on the right, a hormone which normally would stimulate your appetite is also decreased. So patients usually would lose about 55 to 65% of the excess weight in about 12 to 18 months.
And I think in the past you've mentioned that especially with this particular surgery, that it almost immediately decreases type 2 diabetes in a patient that is actually diabetic.
Yeah.
Why is that?
So that happens that happens particularly for the Roux-en-Y gastric bypass, but also for the vertical sleeve gastrectomy. Part of it is because of the decreased intake of food, so their blood sugar glucoses aren't as high. So we automatically, if a person's a diabetic, of course, it depends. Each person is individualized, and we assess each patient individually. But a lot of times we're able to stop the oral hypoglycemic medications almost immediately after surgery. In addition, with the gastric bypass, we're not exactly sure the mechanism with the gastric bypass why the diabetes is improved so quickly. But we also note that as well with the gastric bypass.
So with the gastric bypass, it looks like you're actually almost removing a big chunk of the stomach, as well as, and obviously the word bypass, you're bypassing some of the digestive process. Tell me about this one.
So with the gastric bypasses, we actually don't remove anything with the gastric bypass. We actually are creating a small gastric pouch. Remember when I had mentioned before that the stomach holds about 1,000 milliliters? So what we do with the Roux-en-Y gastric bypass is we create a 15 to 30 cc gastric pouch. So of course that's very small. So once again, as food comes down, it would restrict how much food you're able to eat at one time. In addition, you're right, we do bypass the remaining portion of the stomach and the first portion of your small intestines. It's in that first portion of your small intestine where most of your fats are absorbed. So by bypassing that area, you have a degree of what we call malabsorption of fats. In addition, with the gastric bypass, by rearranging the intestines in the fashions that we do, you develop something called dumping syndrome. Dumping syndrome is a condition whereby if you eat the wrong foods, you will feel sick. Those foods tend to be complex fats and sugars. And because that portion of the intestine was not used to it, the intestine will fill with fluid, and sometimes you may get crampy abdominal pain, nausea, vomiting. The patient will generally just feel terrible. So that kind of helps them to moderate their behaviors because they know if they eat those foods, they will feel sick. So patients with a gastric bypass usually lose about 65% of the excess weight in about 12 to 18 months. Now, one thing that I really stress for all of my patients is, and although the surgeries will help you to lose weight, ultimately to have long-term success, when I mean long-term, I mean 5, 6, 10, 15, 20, the rest of their life, many years, they have to change habits. So one of the things I want my patients to do is I want them to have weight loss, but healthy weight loss. I want them to get enough nutrition so they're not sickly. One of the things I have all of my patients do, I have them do a certain amount of supplemental liquid proteins every day. This way, I'm assured every day that my patient has adequate nutrition. Once they have adequate protein and nutrition, they don't feel tired. They don't have problems like losing hair. They have plenty of energy. They're actually able to build muscle mass and have more energy to do things like exercise. So this is very, very critical to success. Liquid protein also curbs some of their cravings for the sweets and carbohydrates, which may slow down their weight loss.
And do you actually have your patients work with a dietitian to help them learn these new healthy eating habits?
Absolutely. We actually have certified dietitian in our program who works with our patients before as well as after surgery. So during the preoperative process, one of the things that we do is we want to educate the patients about healthy eating because ultimately to be successful long term, they are going to have to adopt new eating habits and eating whole foods and nutritious foods. One of the problems we have, of course, in our areas of there what we call food deserts, where it's difficult for patients to get healthy foods because the stores are just not available in the area. So that's a kind of a socioeconomic problem that a lot of patients encounter because a lot of the food that they have access to is not always healthy food. So during this process, we really stress the importance of cooking for yourself, not eating out as much, buying fast foods and or carry out foods because those things are generally aren't good for you. So the dietitian will teach them about the nutrition and protein. The dietitian will also, in the postoperative period, be a part of their care as well because we also have support groups, lifelong support groups for all of our patients. One of the few positive things that's happened with coronavirus is that we're better able to get access to our patients via the internet. We have these wonderful Zoom or WebEx meetings. And so now our support groups are actually all online. So patients are able to do support groups in that fashion. We actually even have separate support groups for our male and female patients because men and women may have different issues. And I actually participated in one of those support groups earlier this week, and it was very fulfilling.
So of the two different types of surgeries, do you have a, how do you decide which one to recommend to your patients, whether it's the bypass or the gastric sleeve?
Well, it's a combination of factors. One, what I think is best for the patient in terms of their overall medical history. Another part is also what the patient wants. A lot of my patients already come to me with a preconceived notion of what procedure they want. Usually it's not based upon a good reason other than a friend had that surgery and they were successful. So a big part of my process is educating my patients about the procedures, the risk and benefits of the procedure, and which one they would benefit from. All the surgeries are effective. It's ultimately, but the patient has to take their responsibility. They have to do their part in order to be successful. I always stress to my patients, just because you're having surgery, this is not an easy way to handle a problem. It's just the most effective way because they are still going to have to make the changes necessary in terms of their diet, their exercise, drinking their protein, drinking adequate amounts of water in order to be successful.
And I think a lot of people underestimate the emotional connection to food. Do you have your patients work with a psychologist or a social worker or someone that actually helps them understand the relationship to food?
Yeah, part of the, we do a very comprehensive workup prior to going to surgery to make sure the patients are in the best possible shape to undergo the surgery. All patients are seen by our dietitian, the dietitian. All patients are seen by the cardiologist to make sure their heart is strong enough. All patients are seen by the psychologist to make sure that they understand the surgery and what's required to be successful. All patients are also have an upper endoscopy to take a look at the inside of the stomach. In terms of psychology, we actually have the psychologist also participate in the post-op support group because you're absolutely correct. Food is a central part of most patients' lives. And so we have to change their relationship with food. A lot of patients may become stress eaters if something goes wrong. In order to make themselves feel better, that's what they do. They eat. So for a lot of people, we may be taking away one of their quote unquote best friends, their food. So it's very important for them to understand their relationship with food and make the necessary changes so that they can be successful.
So who is a good candidate for this surgery?
So in order to be considered for bariatric surgery, I only operate on people older than 18. There are programs such as Children's National Medical Center where they do operate on children. Children have special needs, and I think it's best addressed at a specialized center such as Children's National Medical Center. But anyone over the age of 18, if you have a body mass index greater than 40, or it can be a little bit less, greater than 35, if you have medical problems associated with morbid obesity, you would be considered a candidate for surgery. People who smoke would have to stop smoking prior to procedure. And that's important because the number one and number two preventable cause of death in America is morbid obesity and cigarette smoking. So the purpose of this surgery is to make you a healthier person. So part of being healthier is stopping to smoke. So those would be considered candidates for surgery.
Okay. And what's the process? I mean, I know that they have to go through an information session, which I believe is available on your website.
Yes.
And then they meet with you. And how long does the process take? Can I get booked for surgery for next week, or do I have to wait a little bit?
I wish that was the case, but unfortunately, it is a quite a bit of a process. It usually can take from 3 to 6 months to get the surgery. Some patients a little longer. A lot of that depends on their insurance company. Some patients' insurance company will require them to go through a period of what they call medically managed weight loss. That period can range from 3 to 6 to 12 months. Now, one of the things that I think is actually beneficial, and one of the things that I stress for my patients, is it's kind of hard to wake up the day of your surgery and start changing your life. So we want the patient to start making the behavioral changes beforehand. So we actually have all of our patients actually lose some weight prior to the procedure, call it preoperative weight loss. And the reason for that is twofold. Number one, as I mentioned previously, it's difficult for you to change your life the day of your surgery. So you want to start that in advance. In addition, one of the few reasons why we can't do the surgery laparoscopically is your liver is so large that I can't see the entire length of your stomach, even when we try to elevate it. So with the preoperative weight loss, that helps shrink the size of the liver. So that makes it safer better for the patient, and safer for the patient, and easier for me to do the procedure. Because remember, this is an elective procedure, so we only do what we can do safely.
And again, you prefer, or you, as much as possible for both the patient safety and recovery time, you do laparoscopic procedures or minimally invasive procedures, correct?
Yeah, we only do it minimally invasive.
Cool. Okay, well, this has been great, so thank you very much. We have a few folks in the audience. If you have any questions, you're welcome to drop them into the chat box. We are also making a recording of this session that'll be made available as well. But I think this has been great information, so let me just do a real quick wrap up. Patients who are over the age of 18 have a significant BMI, either over 40 or over 35 with comorbidities. Comorbidities being things like diabetes,
high blood pressure,
hypertension,
obstructive sleep apnea.
Got it. Okay. Who are, now I noticed on this slide, have failed medically supervised weight loss attempts in the past. Is that basically referring to the folks who have lost weight, put it back on, lost 10 pounds, put on 20, lost 50, put on 75?
Correct. In addition, we actually will have all patients. A lot of insurance companies want you to go through a period where you have a professional monitoring your weight loss. So we actually have a dietitian in the office who will do that for the patients, where they'll have them attempt to lose weight prior to the procedure. So that's where the time frame, the 3 to 6 to 12 months, can come in for the patients.
Got it.
And some patients may have already. Some patients may have already been in that kind of process, and that can count for them for their period of medically managed weight loss. So in those cases, some of those patients may be able to go to surgery a little bit faster.
Got it. And once I've had the surgery, do I ever see you again?
Oh, you will see me for the rest of your life. Follow-up is forever. This is important because, this is a chronic problem. This is not an acute problem. When I mean acute, this is not, for example, I also do general surgery. So if someone has an inflamed appendix, they come to me, they're in pain. We take them to surgery, remove their appendix. We see them for a few days, a few visits afterwards, and then they're released, and they may never see me again. Whereas with the weight loss surgery or bariatric patients, they're my patients for life. They come to me after the surgery. There's a period of every 3 months for the first year you're seen by me, then every 3 to 6 months, then once a year forever. And the reason is we want you to make sure that you're not developing any nutritional deficiencies after the surgery. We also know that when patients are more engaged with the practice and follow up in intensive support groups, they have better long-term success. This is why follow-up is forever. In
Got
addition,
it. That's wonderful.
and in addition, one of the things that a lot of patients tend to be concerned about after weight loss surgery is the development of excess skin. So we also have a board certified plastic surgeon who works with our patients. Once they've lost significant weight, they can be seen by the plastic surgeon, and some of those issues can be addressed.
Yes, I would imagine if you're losing 100 or 200 pounds, that there's going to be a lot of excess skin that just, you won't even notice you've lost weight because it still looks like you're carrying all that extra weight just because the extra skin.
Right,
Yeah.
and
Wonderful.
sometimes they can develop rashes and things like that, and so the removal of excess skin can be necessary. Now, not all patients require it. One of the things with more exercise and lifting things like doing resistance training or lifting weights, that helps decrease the amount of loose skin.
Wonderful. Okay, well, I don't see any questions popping up. So I want to thank you for your time. Anyone who has any questions for Dr. Rickford or would like some more information, you can scan that QR code on the screen. It will take you right to the bariatrics pages of the Capital Region Health Medical Group. Thank you so much for your time, Dr. Rickford. This has been very informative. Any last notes you want to make to folks?
No, look forward to seeing you. Thank you.
Great. Thanks very much.
Bye-bye.